So, in this video we will see and learn about suturing techniques. At the end of the video, a student should know what is a suture, to know in detail the principles of suturing, suturing techniques, and also about surgical knot tying, to know regarding the suture removal and what are the various other methods of wound closure. So, when we talk about suturing techniques, it is important we know about the suture material and also what is suturing. So, by use, a suture is a strand of material used to ligate blood vessels and approximate lacerated or incised tissue. Suturing is an act of sewing or bringing severe tissues in close approximation till the healing process provides the wound sufficient strength to withstand the stress without the need for a mechanical support. So, what do we achieve by suturing is basically, as we have already discussed, it approximate the tissues with adequate tension. Of course, we need to understand that it should not cause tissue ischemia and necrosis, and also to maintain hemostasis. More importantly, permit primary intention healing and reduce post-operative pain. It also should provide support for tissue margins until they have healed and to prevent bone exposure so that the delayed healing or unnecessary resorption of the bone does not take place, and to permit proper flap positioning. It is always important to know the principles of suturing. So, first and foremost is we should hold the needle in such a way that it is held at a distance of around 2/3 from the tip and 1/3 from the eye of the needle, and needle should enter the tissues perpendicular to the surface. Needle should be passed through the tissues along its curve, and it should be placed at an equal distance and equal depth from the incision line so that the uniform closure is achieved. Tissue eversion should be present once we finish the suturing, and tissues must never be closed under tension, and if it is closed under tension which is evident with the presence of a blanch, then we are heading for a problem, that is wound necrosis. Place sutures around 3 to 4 millimeters apart and must not be placed on the incision line, and we should always remember to prevent any dog ears. Let us see what are the different types of sutures that we normally use in maxillofacial surgery. First and foremost is the interrupted suture. The distance between each suture and between that of the suture and the incision line can be pre-decided or determined. They are stronger, and loosening of any one suture will not cause to the others to loosen, and in areas of tension when strong closure is required, interrupted sutures are preferred, and in case of infection, removal of infected suture is sufficient. Figure of 8 suture is normally used in extraction sites. It provides protection to socket as well as adaptation of gingival papilla around the adjacent tooth. Horizontal mattress suture is used when a needle is passed from one edge of the incision to the another, and again from the later edge to the first edge in a horizontal manner, and a knot is tied. Helps in tissue eversion. And interrupted produces a broad contact of wound margins, and a continuous intraoral bone grafting may cause constriction of the blood supply at the edge of the incision and result in wound dehiscence. So, we should not use excessive stress or tension while using a horizontal mattress suture. Vertical mattress is something similar to horizontal mattress but differs in depth. One deep pass supports the wound and the superficial pass brings the edges together and everts them. They run parallel to the blood supply of the flap, so the healing is better because it does not compromise the blood supply to the wound margin. Provides maximum tissue closure, more eversion than simple interrupted suture, and it is used or suitable for suturing interdental papilla, deep wounds in areas where the wound contraction could cause dehiscence or broad contamination. Continuous sutures are placed when we have a precise flap placement. It also reduces the need for multiple knots. Suture passes perpendicular to incision line below and obliquely above. Greater distribution of forces over the flaps is seen. It is simple, faster, and then we have continuous locking, wherein a locking is provided so that the suture is held in place without any relaxation. It also prevents excessive tightening of the suture and usually used in a linear or a incised wound. Even though it avoids multiple knots in suture, like in continuous and continuous locking suture, any one junction or one knot with one suture which becomes loose can cause the entire suture to untie. Subcuticular sutures are held in close approximation just below the skin surface. We use these suture materials when we require a cosmetic results that is very much desired. And continuous short lateral stitches beneath the epithelium can be used in conjunction with this subcuticular sutures when we think of a possibility of a hematoma or inflammatory edema. Differential suturing is used when there is an uneven surface of wound that is seen. It is also important to know that knot tying. So, we should not use excessive tension, which I have already discussed, and maintain adequate tension so that the wounds come in contact with each other so that a proper healing takes place. When we talk about knots, there are different knots. The first and foremost is the square knot, which is formed by wrapping ties around the needle holder once in opposite direction between the ties. And a surgeon's knot is formed by 2 throws of suture around the needle on the first tie and 1 throw in opposite direction on the second tie. And the advantage of this is it reduces the slippage of the first tie, especially when we use braided sutures. Granny's knot is something where we throw a tie in one direction followed by a single tie in the same direction first and the third tie in the opposite direction. So, that is one clockwise, second clockwise and the third one in anti-clockwise direction. Whenever we remove the suture, it is important that we should remember that the part of the suture that is exposed outside on the wound can be contaminated. So, when we remove the suture, it should not allow the passage of these contaminated suture material into the tissues. So, we should always grasp the suture elevated on the epithelial surface and you should cut very close to the epithelial surface and remove the suture. Today we have various other methods other than suturing to approximate the wound. So, in a pediatric patients who are not very cooperative for suturing under local anesthesia, we can also use cyanoacrylate glue, which was popularly used on wounded soldiers in Vietnam, and you can use it in the form of a spray or a gel It is useful in closing superficial lacerations under low tensions. Good cosmetic outcome, and we use N-butyl cyanoacrylate or 2-octyl cyanoacrylate for this purpose. We can also use surgical staples, or it is also called as staplers, can be applied more rapidly, it takes less time for closing the wound, and normally these are made from stainless steel and are placed uniformly to the span to the incision line. They are associated with lower rate of foreign body reaction and infection, and routinely they are used in the scalp, trunk, extremity of wounds, and when saving time is essential. Whenever there is mass casualties, in such situations we use these surgical staples. Their use is contraindicated when it is not possible to maintain at least 5 mm distance from the staple skin to the underlying bone or blood vessels. They do not allow as precise a closure as sutures and are slightly more painful to remove. And we also require a specialized device to remove these staples, otherwise it becomes very difficult to remove. Adhesive tapes are another method of closing the wounds. Again, these are normally used in superficial lacerations in children or pediatric patients because of low discomfort during application. Patient should be advised to keep the wound closure tapes dry for the first 24 to 48 hours, and normally these tapes are usually remain in sight for about 1 week. So to conclude, it is important to know about the various sutures and suturing materials so that the clinician can use these materials as per the situation and need. Thank you.